Inside the Village.
I do want to ask about school suspensions as well, Doctor. This is something in the headlines. I believe where you are in the region of Waterloo, they've just suspended 920 children today,
Right.
I believe, or yesterday, and the secondary school students. Obviously, public health has been warning about this for a month, that if you, don't have your vaccination, if you don't have your vaccination records up to date, you could be suspended. And just to be clear, that means that you're either vaccinated, or B, that you have the exemptions that are allowed, whether it's on a religious,
Right.
medical exemption or religious or conscious decision. I guess I just wonder, first of all, Doctor, is that the right strategy? Do you think the suspensions is a pretty blunt instrument, but is that the right strategy here?
Well, I think in terms of emergencies, that's something that we are facing now. That's something you have to do. Ideally speaking, you would be screening these children when they are entering into the school system, or basically even when they are on the waiting list, for example, to enter into like schools or other places. So I think now, because they are there, now you have to do something, because if you don't get them vaccinated, the disease will spread very fast. It's very difficult to control. Just imagine, like on average, like you could say, like 15 people getting infected, 15 children getting infected, and then they go home. Let's say if their parents are also not vaccinated, then their parents will get infected. So in terms of that, yes, it is. It does seem cumbersome on patients, but in the bigger picture, you'll have to do certain measures. Otherwise, it's very difficult to stop the spread of this disease.
I guess for me, where I struggle is we're at a point now, let's say there's 70% or only 60% of people getting vaccinated. So the school system or the public health unit will have 60% people with a vaccine record saying they've got their vaccine, and another 40% with some kind of exemption.
Yeah.
I wonder, at what point is it even worth keeping track of these
Exactly,
records? Because
yeah.
it's just not there where you need it to be.
Well, I think if you look at the records, you will see people don't have that many exemptions. It's basically more about people who are on the fence on giving vaccinations to their children, or people who are not convinced. The exemptions are not a lot, actually. Well, fortunately, in Canada, they are not a lot. So if you reach the 95% coverage, then you will see that the outbreaks you won't see the outbreaks, you'll see the cases declining. So that's what the region is hoping for when they do all the suspensions and other measures.
It's interesting, right? I do find it very fascinating, Doctor, because you can have a medical exemption, like you said, or you can go online and obtain what's called a statement of conscience or religious belief exemption, which must be signed by a commissioner of taking affidavits. You have to get somebody to sign it. And under this scenario, parents must watch a vaccine education video. So I'm assuming the hope is that when people go down that road, they might get these parents in front of the TV and they'll watch this and say, okay, this is a dumb decision.
Yeah.
Is that working, do you think?
It's possible that but I think maybe you would need more of a concerted public health effort here, not just like asking them to watch a video, but maybe connecting with a family doctor or somebody who can explain to them the reason why you need the vaccine. So I think that's where the effort should be as well, like public health communication. How do you communicate to people who have these exemptions?